Hello, everybody, and thank you so much for joining. We're delighted to have Dr. John P. Gilmore here to talk to us today. John is an assistant professor in nursing here at the UCD School of Nursing, Midwifery and Health Systems. And John's research and teaching is broadly centered around themes of inclusion health, social justice, LGBTQ plus health, and broader sexual health. And John is here to talk to us today about his Fulbright program journey. So John was the recipient of the 2022 Fulbright Health Impact Scholar Award, and he's just recently returned from San Francisco in the US. And I'm delighted to talk to you, John, just a little bit about your Fulbright journey, kind of, what inspired you to go down this route, and any words of wisdom for those who are kind of considering the Fulbright program for the
Absolutely.
future.
So thanks, Emily. So I'm a nurse, and I've worked here at UCD in the School of Nursing, Midwifery and Health Systems for about 4 years now. Prior to that, I worked as a senior lecturer in nursing in Canterbury in the UK, and I have about 15 years clinical experience in various different roles as a nurse and as a nurse educator, predominantly working in areas of critical care in the intensive care unit, but also in primary care, in emergency departments, in sexual health, in rehab, and a short stint in intellectual disability nursing also. So I have kind of a broad array of insights and experience from a clinical perspective. But alongside that, I've always had an interest and a passion and a commitment to social justice. I have a master's in human rights and social policy, and I've been involved in various different levels of activism and advocacy, particularly around sexual and gender minorities or lesbian, gay, bisexual, trans, queer, and intersex communities. And I've done that at a European level and at a national level. And my work now really kind of brings those things together. So I'm really interested in challenging inequities that different groups face, particularly sexual and gender minorities, but not only. And try to change the health system and take a systems approach to ensure that our healthcare, our health services, our education are all a little bit more inclusive of diverse needs, and of groups which maybe traditionally don't have the best experience of healthcare or poorer health outcomes.
And John, did you bring those themes to the Fulbright program? I suppose you can kind of tell us a little bit about the program and what interested you about it.
Yeah, so Fulbright is the largest and probably most prestigious exchange program for cultural and scholarly exchange in the world. And the idea with the Fulbright program is it supports students and scholars from America, from the United States, to come to various countries in the world and to bring their knowledge and expertise and their values and experiences to places like Ireland. So the Fulbright Commission in Ireland supports American students and scholars to come here, but also for Irish students and scholars to go to America. And for me, I work in a field when I think about LGBTQ plus health, where there isn't a huge amount of service provision in Ireland. It hasn't been as developed as a field of study or a field of practice in Ireland or in Europe more generally, but it has in the United States. And I really wanted to understand the experiences and that move in the United States to having a more established health system which accounts for the needs of sexual and gender minorities. So the Fulbright program isn't just about the research, and I was doing research, but it's also about the connections you make, and I suppose what you bring as an individual, a scholar and a person to the United States, and what you learn and bring back then to your own setting to help you in your work, and from my perspective in my work to try and make the Irish health system more diverse and equitable for different groups.
I suppose, John, that's kind of the benefit of the Fulbright program, really, is you're learning from another culture, another system, and bringing it back to the benefit of the Irish healthcare in this setting for the Irish healthcare system. And was that, you kind of explained about what was interesting, that the systems over there, the supports there, are more established than here. And I suppose, was that your focus of your trip? Was it to was there anything in particular within that sphere that you wanted to bring back?
Yeah, so I was really lucky on my Fulbright experience. I was over in the United States for about 6 months. Most of my time was spent in California, in San Francisco, and I was based at UCSD Health Equity Lab with my mentor, Professor Anissa Flencha. But I also got to spend a few weeks in New York at Columbia University in the School of Nursing there, in their Center for Sexual and Gender Minority Health Research. So it was really great to see the kind of focus and the embedding of the kind of work I do within schools of nursing, and they're two of the most well established and acknowledged as the best schools of nursing in the world. So they're ranked number one and I think number 7 right now. So while I was there, what I really wanted to do is work with clinicians, so doctors and nurses and nurse practitioners and other clinical professionals who work in the field of sexual and gender minority health, to really understand from their perspective what enables them to do their work, what are the issues that come up in their work, caring for lesbian, gay, bisexual, trans, queer, and intersex patients and communities. And are there barriers that can be overcome that they've faced in their careers? Alongside that, I was really lucky to be able to participate in Pride Labs. So Pride is the largest longitudinal study of sexual and gender minority health in the world. And my mentor is a co-director of the Pride study. So they every year have ongoing surveys and also other research that takes place on a sample, a very large sample of LGBTQI plus people from around the United States. So I got to learn with and from those people involved in the Pride study. The other thing I got to do, which was really great, was I took part in an early stage investigators training program. So I got to work alongside 6 other people at my level, essentially assistant professors in the United States who were working in the field of LGBTQI plus health. So learning from them and learning with them and building the connections for the future to work alongside each other and to complement each other's work. While the US is a really different context and the health system is so different over there, a lot of the values healthcare professionals bring to the care are the same. The experiences are often quite comparable for the patients and the communities. So there was loads of learning there in terms of, how one might develop maybe services for LGBTQI plus people here. How might one go about researching health issues, which is what I do, but also building those connections for future collaboration, which was really valuable.
Yeah, it does sound like a key benefit of the Fulbright program is the networking opportunities and to meet peers as well in the space that you're interested in. And John, I know you spoke a little bit about the Fulbright program, but what is what does the application process look like for someone who might be interested? Is there a certain amount of work that needs to be done prior to applying?
I think the one thing I will always say when I'm talking to people about Fulbright is it's really important to note it's not like a research funding grant that you get to do the research and that's really focused on the research you're doing or the activities you're doing. Fulbright is about you as an individual scholar. And I suppose reflecting what it is you can bring to the United States, what it is about you as a person, and as your experiences and your focus, and why that's important to wherever you decide you want to go in the United States. And then on the flip side, it's about choosing somewhere and choosing an activity or activities that you feel will be valuable to your own context. So for Fulbright Ireland, for an Irish context, why, I mean, lots of research, those of us who are researchers, lots of research, you don't need to go to the place to do some research. So it's really about embedding yourself and talking about yourself in that way and why it's going to be valuable and what will happen from this exchange. I think, the work is really important and you get huge opportunities to work with amazing people who have done amazing things. And I really did with Professor Flinch and also Professor Tonda Hughes, who I worked with in Colombia and built those connections, and I'm continuing work. but also the amazingness of being in a different culture, in a different context. I'm a queer man. I went to like a place, San Francisco, which is deeply important to my community culturally from a global context. So I spent a lot of time in what was a camera shop where really famous um, politician Harvey Milk, who was one of the first openly gay elected people in the United States, openly gay men elected to office prior to his assassination, where he based all of his activism and political advocacy from. It's now an art gallery, a community space for queer people to come together, to commune, to sell their art, to exchange ideas. So I spent a lot of time there. I got to meet, I got to meet the Speaker Emeritus, Nancy Pelosi, and briefly kind of engage with her. I spent time with the Irish ambassador and the consulate general. Spent a lot of time in the consulate in San Francisco again to bring that nuance of kind of, I wasn't only understanding America, it was also understanding what Ireland has done for America prior to me. That's really important as well, as recognizing those links and continuing to build those links, which is core. I got to see lots of things. So I got to, when I was in New York, or I visited the LA LGBT Center, which is a massive health system for LGBTQI plus health. And I really got to understand, lots of nuances about the American system, and about the people there and what can be done when individuals are committed to social change. The United States has lots of issues, lots of problems, like any context or country has. It's dealing with division, it's dealing with tension, but it's also full of amazing people who are generous and empathetic and loving. And I got to experience all that in a real lived way. So it was just, while, it was hard being 6 months away from my home, from my family, from my husband, it was also, I miss it now. I miss my friends there. I made friends for life there because of that generosity and because of seeing people and meeting people who I could really connect with, despite having maybe some other very obvious differences.
Yeah, and it definitely, you kind of said it as well. It's the social aspect of the program as well is really key, and it's something we sometimes forget a little bit about. It's not just doing your research and having your meetings and doing presentations or going to conferences, etc. You do have that social element, or I suppose the tourism type element of it, that you get to see and visit places that you may not necessarily have been before.
I mean, when I was in San Francisco, and so my research and my work goes across kind of issues of social marginalization and inequality. So while a lot of my work focuses on LGBTQI plus communities, I do work with homeless people, with migrants and asylum seekers. And while I was in San Francisco, I lived in the Tenderloin. So that's a kind of an infamous place. It's downtown. There's a lot of issues around substance use, problematic substance use, fentanyl addiction, homelessness and unhousedness. And I got to be centralized there and see and understand the real lived experience of people. And in a lot of ways, think about how lucky we are in Ireland in terms of having, a more universal approach to education and building a universal approach to healthcare, rather than a totally privatized system. So, but when I was there, it was also interesting to note that it's an area of historical significance for trans people. So there's long-standing connections with that place, and seeing there and being there and just getting to know people and hearing perceptions of Ireland as well. I think one thing, people have different perceptions of Ireland. Some American people haven't really heard of Ireland. A lot have, and a lot have these connections. But sometimes, the work I do is around sexual and gender minorities. And for a lot of people, they never think of Ireland as a place where somebody can be openly queer or gay or trans or lesbian, because they have a very different view of what Ireland was. And Ireland has gone through rapid social change. And I don't think we always reflect that when we talk to maybe our descendant communities or diasporic communities. So I did lots of that as well. I got to talk to people who had lived outside of Ireland for 40 years, meet them at the Irish Cultural Centre or cultural events. I mean, I was lucky as well on my Fulbright journey. I had two other Fulbrighters with me at different stages. So Adele Mead, who's an amazing singer and composer and songwriter, who was based in Berkeley, and Angie Butler, who came from the tech world, and she did loads of work on AI and performance. So we got to kind of, I had a peer group who I could also reflect on the bizarreness of being in another country. So that was really helpful too.
Yeah, and talk to me a bit, John, about what kind of supports does Fulbright bring while you're over in America? Is there any, do they touch base with you at any point? Is there anything you need to, report back to them, etc.? Maybe talk to me a little bit about the touch points you had with Fulbright.
Yeah, I think the most important thing to say is that, when you are successful through the Fulbright program, when you become a Fulbrighter, which is the language, you're expected to be the type of person who can be, I suppose, an ambassador and an advocate for Ireland, and kind of look after yourself. It is for people who have that ability to connect, and who will be connected. So they don't ring you every week to make sure you're okay. That the expectation is, and the process that one goes through is to kind of make sure that happens. There is there in San Francisco and regionally there are social networks of Fulbrighters. So I was able to attend some events within, kind of with other Fulbrighters from other countries who had come from India, had come from Eastern Europe, had come from Russia, had come from Italy. So I got to meet them and exchange kind of ideas with them and perceptions. But I think it is about that kind of independence, and it's, and again, it's a very prestigious honor to become a Fulbrighter, and the expectation is that you've reached that, and you will carry that forward.
Yeah.
So, it is sometimes, I think people expect maybe sometimes to have a more scheduled plan of, this is what we'll do, and we'll set you up with this person, and we'll connect you with this person. But really, that's your job.
That's your job.
And thankfully I had loads of opportunities. I got to, I'm a social person, but I certainly am not out in Dublin 5 nights a week. But, I found myself out and at events and meeting new people quite a lot when I was in San Francisco and New York, because the opportunities were there. And that's what's really important, is you continue to take those opportunities, and then think about how you can support others going forward, and keep those connections going.
Yeah. Yeah, no. And John, tell me, was there a standout moment or a person that really just did it for you, inspired you while you were out there? Was there anything that you took away as a standout?
I think I met some really close friends for life there, and I wasn't expecting to make such deep connections. But I think just being there, I think I got to do so much. I was there for Pride, so one of the largest prides in the world, where a city essentially gives itself over to lesbian, gay, bisexual, trans, queer, and intersex people, to celebrate them and to say, you are the most important people on this week. So it was great. I got to be there and march in front of the Irish contingent, along with the EU contingent, and build those connections with our consulate colleagues out there who do an amazing job. We have an amazing Consul General, Micheál Smith, and Jen Chadwick, who's the Vice Consul there, became a dear friend while I was there. And I think, I got to take part in the AIDS walk in both New York and San Francisco. So, really kind of come together, and I work in sexual health. So to remind ourselves of what an impact that had on my community globally, but also a continuing impact for people living with HIV and AIDS around the world, to remind ourselves of that. And just I met so many amazing people. It would be really hard to name all of them. And they're not people I'll never see again. I feel like, almost everyone I met there, I'm already planning on trying to go back at some stage, or welcoming people back to Ireland. And we actually had, so my host at Columbia University was Professor Tom Hughes, who was their Dean of Global Health, and just a couple of months ago, she came to UCD, and she gave a lecture here, and got to meet a lot of government officials and community sector organizations, and colleagues and faculty here as well, to talk about collaborations and research. So I think that's what's important. We continue to move forward. Since coming back, I've joined the Fulbright Diversity, Equity and Inclusion panel, which aims at kind of supporting the programme for the Fulbright Commission in Ireland to become more equitable, to become more inclusive, and really, continue those relationships with the Commission and with various other Fulbrighters who are coming to Ireland or supporting people who are planning their trip away.
Sounds brilliant, John. Honestly, you can tell just by your expression on your face, you thoroughly enjoyed it. I suppose just to close things off, lastly, John, is there kind of any kind of piece of advice or wisdom that you might give to someone who's thinking of applying for the program and going on this journey?
I think it is that be clear on who you are and your strengths and your values and your knowledge and what you'll bring. I think that's really core to really sell yourself. And sometimes it's something that we can be quite, particularly Irish people, can be quite uncomfortable doing. But it's really important that you do. And some of the advice I was given there, with the Irish, forget about your Irish bashfulness. If someone says your work sounds really important and interesting, sometimes an Irish person say, "Oh no, it's just." You're told absolutely not. You say it is interesting because I only do what I do because I love it, because I think it's really important. So to try to do that, try to share that in a way. I think be key in where you want to go and why you want to go there. Like, don't just say because I want to go to New York because it's New York. I want to go to San Francisco. You need to know why, and it needs to be a very clear reason why. And it's not always New York or San Francisco or Chicago or LA. It's, America's a vast country and there are lots of interesting people and interesting things happening there. So I think be open, make those connections, connect with people. And I have to say, I mean, the Fulbright program is far more recognizable in the United States. People know it and people stand back when you tell them you're a Fulbrighter. They're like, wow. So I think make those connections, be open. I think the scholars I met in the States across the board were very generous, very encouraging, really keen to work and to support, people like me, early stage investigators to really progress. So I think reach out and be open and also look at the Fulbright website and see all of the scholars who have come and gone before and reach out to us because all of us are quite open and it does, I mean, it's that cheesy thing of it's a family. I mean, I'm not sure it's a family, but we are all part of something and we are all people who are deeply committed to cultural exchange and learning through scholarly exchange. That it opens your eyes, makes you think in a different way. So definitely scholars ourselves as alumni will often be really helpful in supporting people.
Thank you so much, John. I've really enjoyed speaking with you, and I hope that's been useful for those who are considering the Fulbright journey. And thank you for watching. We will have John's contact details with this video, so do feel free to reach out to John with any questions that you might have. Thanks again, John.
Thanks, Emily.